Welcome. This is Virtual Obstetrics and Gynecology. Today's topic is a very interesting one, the premature birth. Today we are accompanied by Dr. Enrique Cruz. How are you? Well, first of all, thank you for the invitation. Alright, let's begin. In what moment is it considered a premature birth? Well, first we will consider, and we must recommend that this is all determined in the weeks of gestation. During the pregnancy, the control, it is very important for the parents to know that the control will be determined and estimated in weeks, not months, not 7 months, 8 months, or 9 months, because it is very important depending on how many weeks of gestation. This will determine the development of the baby. In general, a baby will be deemed premature before 37 weeks of gestation. There are some classifications that determine, depending on how many weeks, there will be various forms to determine these weeks of gestation. Ideally, whenever a mother suspects that she is pregnant, she should go to her gynecologist and get an ultrasound done. The ultrasound will be done in the first gestational period, and this is very vital in determining the weeks of gestation. Some other methods that are usually realized in order to calculate the weeks of gestation, and which are done by pediatrics, are based upon their physical characteristics. Sometimes a mother doesn't have proper control of her pregnancy. She won't know when she got pregnant. She doesn't know her date of last menstruation. So based upon the physical characteristics at the moment of birth, we will be able to determine if the baby is of term. And usually the term used to describe this, as we mentioned before, is of term. We must remember, of term is whenever a baby is of 37 weeks of gestation, or premature whenever a baby is before 37 weeks of gestation. Dr. Alejandro, what are some of the causes of premature birth that can be associated? Well, first of all, greetings to everyone, to all our fans. Well, the most common causes of an early birth are caused by infections. Any infections will cause stress. All of the stress can cause an early birthing process, as we mentioned before, of the 37 weeks of gestation. The most common ones are a vaginal or urinary tract infection, which, even though these are the most common, there will also be more severe cases of infections. And the greater an infection, the greater problematic and susceptibility that there will be of causing alterations in the uterus. Enough changes that will provoke an early birth. Some other occasions that can occur are whenever the membranes break. This will cause an early birth due to the processing of the mechanism of the body, in which the fetus and the sac are no longer together. This will cause the uterus to contract and provoke an early birth. A third case which can occur is any illnesses in which the mother has. These will cause an interruption of the pregnancy. One example of this will be a severe preeclampsia, or as it is also mentioned as fetal distress. These are some of the two most common occurrences in the pregnancy in the third trimester. These can occur before the 37 weeks of gestation. Many women are currently asking, what are those signs? Some warning signs associated with the early birthing process. How will I know this is going to happen? What can I do in order to prevent it? Well, first of all, the warning signs are mostly related with the changes in the neck of the cervix and the uterine contractions. If you present any of these signs, such as contractions before the 37 weeks of gestation, it is very important that you go to your gynecologist for a routine checkup, and they may even go through other medical exams in order to determine. It can be a laboratory, even a vaginal tract, or an ultrasound in order to determine if there are any warning signs of an early birthing process. Here we heavily emphasize the controlled pregnancy. Dr. Cruz, what are some of the complications that a premature baby may present? The most common secondary related illnesses are respiratory difficulties. Whenever the baby matures, the lungs previous to birth are filled with a liquid. They aren't filled yet with air. Whenever a baby takes its first breaths, that liquid that is contained in the lungs will be drained and it is replaced with air. Whenever a baby has less weeks of gestation, they have a higher probability of them not having fully matured lungs. You can imagine it as for example, if the lung is a wet sponge, the sponge will remain really wet, and with lots of liquid, it will be very porous. Whenever the lung is not mature, this will be called a hyaline membrane illness. And these are usually the two most common respiratory difficulties associated with premature babies. A secondary would be a transitory premature tachycardia. This is, for example, a wet lung that will take some time for it to absorb. These usually don't leave any adverse effects or any problems down the road. There are some other measures that can be taken in order to determine how much difficulty a baby has breathing. We may even use, for example, some oxygen devices such as a breather or an air mask in order to fully develop and to determine the severity of it. Whenever a baby has less weeks of gestation, it doesn't have a proper chance to fully secrete a substance called pulmonary sulficant. This is a substance needed for the lungs to fully mature and have adequate air diffusion down the road. If there isn't any of that substance, in some cases, the patients may be administered this during their pregnancy and wait for it to take effect. There are usually 4 stages associated with this. Stage 4 is the most severe and requires a respiratory machine to help. There are other complications also associated with difficulty breathing. For example, neurological, urinary, or ophthalmic affectations, or even affectations to the proper retina. In boys, as we must remember, their testicles do not descend until the 24 weeks of gestation. There may also be intestinal problems throughout the baby, which require it to be in fasting. The immune system may not be properly developed, and due to not being properly developed, it will not adapt correctly to the external factors and will be more propense to being ill. In which, depending on how, as we must remember, the more premature the baby is, the more severe and the more secondary effects will arise from it. Doctor, you mentioned some, but what is the treatment usually in these cases? The treatment is very multidisciplinary. It is determined by various factors. For example, if I know that the baby is premature and it has respiratory difficulties, first of all, we must try to obtain oxygenation. First of all, to prevent neurological problems. Very important to maintain also adequate kidney function and proper nutrition. If it is going to be fasting, there are some substitutes available that can be administered through catheters. Usually some laboratories are taken in order to determine if there are any substances missing in the blood, such as, for example, calcium. All of this is required in order to maintain a proper homeostasis throughout the body, but also, as we must remember, to prevent any auditory, neurological, visual, or respiratory problems. Also, it is very important to mention that whenever a baby is given oxygen, the longer it is given oxygen, the greater the consequences this will provide in the long run for the baby. Dr. Alejandro, what is the plan in the patients with a high risk of this occurring? What usually happens? Like we mentioned before, with the warning signs such as contractions before 37 weeks of gestation, first of all, we must stop these contractions from occurring. Usually this is done through pharmaceuticals. In this form, the most common ones associated with this are through steroids. The steroids will help in a certain form to stop these contractions and will also allow for the baby to develop or mature its lungs properly. It gives a short period of time for it to have a greater possibility of this occurring. And as we mentioned before, this will allow for the sulficant to be released and also help the baby at the time of birth. Obviously, there are also other methods that can also be realized. One of these can be through an amniocentesis. The amniocentesis is usually done by puncturing the fetus sac, but due to this being very invasive, it is not commonly recommended. But as we mentioned before, in a premature birth, what we try to focus on is administering steroids in order to prevent the birth before the 37 weeks of gestation, in order for it to fully develop and mature its lungs and give it a greater chance in the long run. And that is usually the recommended outcome and what we usually try to abide by.
Dr. Cruz, what are some of the adverse side effects or consequences that can occur in a baby that was born before 37 weeks of gestation?
Well, the most severe side effects that can occur are the neurological deficiencies, or so to say, whenever a baby is born premature, it already has a disposition to develop infantile cerebral paralysis. We must remember that this treatment is very multidisciplinary. You do not only treat the premature baby whenever it is born, and at that moment, it is very important to not forget about it. It is very important to go through follow-ups, go to a specialist, pediatricians, make sure to check up on ophthalmologists, and be vigilant of the baby's neurological development. And as we must remember, the baby neurologically will develop, for example, at 3 months of age, it will hold its head up high. 6 months, it will start to sit. It will begin to crawl at 9 months, and around the year mark, it will begin to walk. There are also some other exercises available in order to stimulate this neurological growth. These are usually offered in various parts of the urban area, and they are offered to both babies with or without neurological abnormalities. It is very important to remember that if a baby during the premature birth, if it had any visual difficulties, to follow up with an ophthalmologist. There are also laboratories taken for newborns, such as the heel prick test, in order to determine any illnesses or any deficiency in their thyroid. Some also secondary exams that are done to determine any abnormalities would be auditory tests. These tests are usually done on the second day of birth. Sometimes whenever a baby is too ill, these tests aren't done in time. So it is recommended that whenever a baby is dispatched from the hospital, that the parents go and realize this test in order to adequately determine if the baby is hearing correctly or not. And also, we must mention that if any genetic abnormalities are present, to follow up through a geneticist in order to determine any of the follow-up treatment and what can occur further down the line. And always follow up with your pediatricians, go to your dates on time, and be properly vigilized.
We know for all of you that this is a very important topic, and to know that whatever happens will not only with the mother but also with the baby as well. If you have any questions, suggestions on further topics, we recommend that you leave a comment below. And if you have any further topics you would like to talk about, make sure to leave a comment below, leave a like, follow us on our social media, and until next time, thank you.